Welcome, everyone. This is Pam Dunwald with Your Nurse Advocates Consulting, and we are here for another session of our Senior Care Summit 2024. And today we have the pleasure of bringing you Dr. Richard Foss, who's an optometrist from Family Vision Center in La Crosse, Wisconsin. And we are going to talk about normal changes as we age, and just as things change as we go through life with our vision. So welcome, Dr. Foss. We're really excited to have you. Dr. Foss, before we get started, can you just tell us a little bit about yourself and maybe your office and what your experience has been?
Well, I started practice in 1974, so this will be my 50th year. So I've seen all phases of the aging process with my patients. So as I've got older, my population of patients is more and more senior citizens than ever before.
Mhm.
So it's kind of appropriate to talk about these sort of things. Our practice is a multi-phase practice. We've got 5 doctors, and we got one is specialized in dry eyes. Another one is a really good with specialty contact lenses. I work a lot with glaucoma, diabetes, macular degeneration. My daughter, who's my boss now, is a specialist in vision therapy and works a lot with people's brain damage, reading and learning problems, that sort of binocular vision type issues. So we've got the whole thing, and it's just been fun. And I've been involved in all of those because it's just, we try to bring new technology to the office. I probably in a lot of areas way before other people have. So it's been a really fun life, and I just don't want to quit working.
Well, that's wonderful. So you've still got a lot of lives to touch yet. So,
Yes.
so let's go ahead and dive in. So what we're going to do is we're going to talk about some, common changes or common eye ailments that we may see in aging adults. So, Dr. Foss, what would you think? What do you think is the most common changes that we see in the vision as someone ages?
Well, most people, if you're normal, do not need to wear glasses as a youngster. But nowadays, with so many things done up close, a lot of people are becoming nearsighted. There's predictions that by 2050, half the world will be nearsighted. And in some parts of the world, people are so nearsighted it's actually stretching the insides of their eyes out, and it's a leading cause of blindness in Shanghai, China. So we're trying to do more to prevent that for the youngsters by having to be outdoors more, get off the computers so much, that sort of thing. But in general, people, if they need no correction throughout life, about age 40, they start having trouble seeing up close, and that's because it's called presbyopia. We cannot focus as good as we used to, so we need glasses for near. So that's a very common thing. Along with that will come problems with cataracts, glaucoma, macular degeneration. Those types of things slowly increase as our population increases.
Okay, well, let's take these things and kind of break them down one at a time. So one of the things that we had on the list that was common is floaters. What exactly are floaters, and what causes them?
Inside our eyes, there's kind of there's a fluid, and it's kind of in a sac, and the sac is hooked up very firmly at the optic nerve head and at the macula, the part where we see clear, where our central vision is, and at halfway back around the eye called ora serrata. And that gel will shrink in time, and that shell being in a bag. If that bag gets pulled loose, we'll see floaters. And depending on how it's oriented and where it's located, it can bother us. If it's kind of out of the way, it's no big deal. As long as you get floaters and do not have flashes, you're probably all right. If you get flashes of light, it could be a retinal detachment, and that's something that's extremely serious, needs to be seen right away. A lot of people who have flashes, it's because of a migraine, and that's something that'll come and go. A migraine is not going to last for hours, at least the visual part of it. So if you have something like that, that can be thought of most likely as a migraine. But if you get floaters along with that, that's an emergency, should be seen in a day or two.
Okay, thank you. That's good to know. We often, wonder if those are benign or if they don't have cause, but if you see those flashes, that's a great distinction. Thank you for that. Let's move on to cataracts. So what causes cataracts, and why do so many aging adults struggle with that?
I think the main cause of cataracts is time. Everybody's the light coming into our eyes causes our lenses in our eyes that are generally clear when we're young to slowly change and yellow, and that's called nuclear sclerosis. And in time, that can get cloudy enough that we have a hard time seeing. In my particular case, I had them removed when I was 71 years old. I could still see good 20/20 in the daytime unless the light was shining in my eyes. So if I was even in my late 50s, if I went to a football game with the lights on at night, I would find that if I didn't have a visor on my hat, I just couldn't see.
Mhm.
The headlights coming at you were a problem. Even like the blue lights on a squad car, if I was going by one of those, it would really cause problems for me to see clear. So really bright lights causes glare, and glare is one of the most common reasons for people to try to get their cataracts removed, because they're just not seeing clearly at night or when they're really working on small stuff or in bright areas. As
Mhm.
cataracts come, we need more light to see, but light bothers us more. So it's kind of a double-edged sword.
Mhm.
Cataracts can be caused by most likely time, but a lot of it can be the sunlight. I did some work in Vietnam, and a lot of people there have cataracts because they're working outdoors all the time. And they work, a lot of them in the rice paddies working on the water, even though they wear those hats they wear, the light bouncing off the water would give them cataracts. So cataracts is really common when people are in a lot of light. Um, I've done mission work, probably 50, 60 missions, and cataracts are very common in third world countries at a younger age than they are here because people are outdoors more and don't have the light protection. Sunglasses are good, but cataracts can be caused by steroids. So some people get them from steroids. Diabetes can introduce cataracts. Smoking is bad for everything compared in our eyes. It's worse for cataracts, worse for glaucoma, arteriosclerosis. Everything you can think of that's bad about eyes is enhanced by smoking. So that's a biggie. No smoking. Okay.
And I've heard, in my career in that I've heard, certain things. So I'm going to ask, is eye color have anything to do with your risk factor for cataracts?
I would probably say, in a way I could see like somebody could think that, but okay, so eye color, a darker eye, um, I think can handle light better, but the darker eyes are the ones we see when we're in Vietnam and then Central America, Cuba, a lot of darker eyes, and cataracts there are very, very common at an earlier age, I think, because again to the exposure to the light. So
Mhm.
the eye color thing is interesting. I guess thinking along this line, people who are Scandinavian have a very light pigmentation inside the eye. So when you look in someone's eyes that has a lighter complexion, so to speak, you'll see which could be like thousands of vessels, it looks like. And if you have a person that's a darker complexion, possibly a black person or Asian person, you might find that you don't see as many of those blood vessels because they have better pigment, more pigment in their eyes. And that does protect them though from macular degeneration. So that's why you see more macular degeneration with your Scandinavian people than you would with people with more pigment. So that's where the pigment comes in there. And there was some theory at one time that um, this is I heard from a football coach one time that birds that have darker eyes catch their food in the air, and ones with lighter eyes eat off the ground. And so they was trying to correlate that with athletes with the darker pigmented eyes, maybe be better athletes for catching a ball, that sort of thing. So it's kind of interesting thoughts
Oh,
along
yeah,
that line. Yeah,
absolutely. So, but sunglasses can be very beneficial then. If you're out, if you work outside a lot, you should be wearing sunglasses. Is that
that's
true?
exactly right. And you don't have to have a really expensive sunglasses to be a good one. You don't want the cheapest thing in the world, but most of the sunglasses, they say UAB and there's two types of ultraviolet radiation, and you want those to be
Mhm.
protected by the sunglasses. So, but I think all the sunglasses sold here are good ones.
All right, well, let's move on to another a common thing that we may see in aging adults, and that's glaucoma. So how does glaucoma, what causes that and what are the treatments for that?
Well, glaucoma can be caused by, um, so what glaucoma is when the eye pressure in the eye gets high enough, it can actually change the structure inside the eye and shut down blood supply and such, and cut the impulses, the nerve impulses that could cause blindness. So if you can picture this being your cornea, my finger, my hands up here, and then this here, my thumbs would be the iris. Blood or fluid is produced inside the eye. It has to get out of the eye. So it comes around through the pupil and out here through, called the Schlemm's canal. And if that is too close like this, that's called narrow angle glaucoma. And that can shut down an eye and cause blindness in hours. That is very, very rare. So when you go to your eye doctor, what they're going to do, they're going to look at that each time and say, they're going to judge that. Is that safe or is that not safe? In all the years I've had only one person that actually closed up, and that's the person I had suggested that they do surgery on, and it didn't happen, and then it happened, and we took care of it then. So that's narrow angle glaucoma or angle closure glaucoma, so you can also have that area's got a filtering system in it, and that get plugged up with pigment from the back of our iris, and that's called pigmentary glaucoma. So that's again can slow down the fluid from leaving the eye, and it pushes back on the optic nerve and causes damage. So basically it's all to do with pressure, and try to control that pressure. Some people can do exercise and have that pigment in their eye get activated and cause glaucoma that's just temporary, and then when they're after their eyes get back to normal, it comes down to normal again. So in all these cases, the way to treat glaucoma is to try to lower the pressure. So there's surgical procedure for that, and also medicine that can do it. And I think in Europe, they're more leading toward the surgical procedures. Here, we're more leading toward the drops. I think I'm kind of, as time goes by, I'm leaning more and more toward referring to the ophthalmologist for having surgery for that, because drops are no fun. I don't like putting drops in my own eyes, and it's not easy to do. And the most common reason I think glaucoma is not handled well is the people following up on taking care of themselves. It's just hard to do. It's not fun. So I think that's the biggest problem with the glaucoma, is just follow up.
And what are some causes for glaucoma, and are we at more risk for glaucoma as we age?
Yeah, it is associated with age. The causes will begin like the increased output, increased fluid percent. So when the fluid in our eyes gets produced faster than it can get out, that's what causes glaucoma. And so some of the drops will try to decrease the production of the fluid, and some of them will try to increase the outflow of the fluid. So it's all these different combinations of drops you use and procedures you use to try to increase the outflow. So if we can increase outflow, and another thing that's kind of important about glaucoma is when we sleep, our eye pressure goes up and our blood pressure goes down. So we could have at the evening the damage being done while we're sleeping because we can't get enough blood into the eye to keep the eye healthy. So it is something you watch the people very closely. There's special instruments to use to monitor glaucoma patients. One of them is the visual fields, which is a hard test to do, but it's checking their peripheral vision. People don't like to do the test, but newer technology uses a thing called an OCT, which is a scan that can actually look at the different layers of the eye and see how they are being affected, and if they're decreasing in time, or if the optic nerve is getting pushed further back. We can measure that just right down to the micron. So it's a very nice way to watch things nowadays. In the United States, very few people go blind with glaucoma because of the care that's involved.
Now, are there any medical conditions or diseases that can contribute or can precipitate the glaucoma?
Medical, okay, let's think about that.
No, like diabetes or any kind of chronic health condition?
Well, yeah, anytime things are compromised, they can complement each other, make things worse. Yes, yeah, yeah. So I think that with diabetic patients, what we look for there mostly is it's called diabetic retinopathy. There's hemorrhages in the eye and leakage from blood vessels called exudates. Try to make sure that doesn't happen and monitor those people very closely. We have new ways of checking that. We can actually do an EKG of the eye now, so we can predict or watch closer to see if things are changing. That's one of the things we've been doing probably within the last 2 years. And I find that to be very, very helpful in kind of telling people, okay, you're really getting under control. And sometimes one of the things I like to do with glaucoma patients is it's now being accepted that monitoring them with wide field imaging is a good thing to do. And we've been doing that for probably 20 years. And I just starting to now become more published that that's the way to follow people. And you can actually count the hemorrhages in their eyes, watch them closer. But once you show a person what their eyes look like inside, they get their religion and they start taking care of themselves. But if you say, you know, you got this, you got that, when they see it, and I say, now, if this hemorrhage was right here, you'd be blind. Oh, okay. Now they get serious and take better care of themselves. So education of the patient is the key thing in all types of eye care. I think the more the people understand, the better off they are. You know, you always run into people that say, well, I'm doing great. I don't need glasses. That's the least important issue is their glasses. It's their eye health that counts. And you cannot know your eye health unless you're actually being examined on a routine basis. And that's one of the problems. If a lot of people think they're fine because they can't feel anything wrong. In the last year, I think we found tumors on 2 children in their eyes that are life-threatening.
Wow.
And a lot of people don't want to have their kids examined because the kids are seeing fine or something like that. So it's routine eye care is not the big way to make money, but it's the best way to take care of patients.
So when we're looking at our aging adult population, how often should they be getting their eyes checked?
I firmly believe every year.
Okay.
Okay, every year. Now some people will want to go longer than that, but I look at it as what's best for the patient. What's best for the office probably is when people come in and say, I want to get new glasses. And so that's why you see in our business, everybody advertising glasses when they really should be advertising healthcare. But healthcare in itself is not as much moneymaker as if people have to buy a product each time. So I'm firmly believing in yearly eye exams.
So we should treat it just as an aging adult, just like your annual Medicare wellness exam. You should schedule your
Yeah,
eye exam at the same time.
exactly. I even think for children. I mean, because if we can work with children and try to prevent some of these things happening for them, it's important. There are some nice things happening. There are some contact lenses now that slow down progression of nearsightedness. And I just read an article last Tuesday. I'm going to a convention next month, and they'll probably have it there because we always get the first things first on some of these meetings I go to. They're having some glasses that children can wear that might even reverse myopia.
Wow.
And that just blows. I can't figure out how it works, but to me it's
You're
awful
going to find
interesting.
out.
Yeah, yeah,
All
yeah.
right, let's move on. We touched a little bit on diabetes, so let's get into our macular degeneration. So what are some of the causes, and again, how do we treat that?
Well, I think that macular degeneration is probably caused partially by our diet, mostly a lot by our heritage. My mother had macular degeneration, so she had the injections in each eye for years, but it maintained her vision. One of the things there with macular degeneration is if you have your routine eye exams and your doctor's tuned in, a lot can be kept very, very normal for people. I read articles saying that on average, people are not referred until their 20/60 visual acuity. Well, and then with the injections, they can probably get made a little bit better, but it'd be nice if you could get them sooner. And I think that if you're seeing your patients on an annual basis, and if you start to see very early changes, start to treat it. So for macular degeneration, a lot of times we'll see a thing called drusen. It's kind of like little lumps underneath the retina. And I think that if we get people on supplements, we can actually reverse that. And I've been doing that for probably 15 years. So I think we try to do a lot to prevent macular degeneration. The injections they have now are anti-VEGF injections. It first was used for the anti-VEGF was used for treating tumors, and it stops blood vessel growth. And so they're using the anti-VEGF now for diabetic retinal hemorrhages, just regular retinal hemorrhages, and for macular degeneration too. So that's a really good thing to be checked early and get referred early for the treatment. Macular degeneration is actually little fluid in the retina from the blood system, and we can actually reverse that or hold that stable with the injection. So it's a lot of people having this done. I mean, it's just lines of people, I'm sure, at the clinic having that done, but it is so important to get into that early. It's expensive, but there's a lot of programs to help with that. My mom had injections for probably 10 years, and she had insurance, which was good, but there was also some other help that was available that just appeared. We, I guess, applied for it, but there's a lot of things to help people. They should not let money be the problem in taking care of their eyes.
Now, what if macular degeneration is not treated? I mean, will that lead to blindness, or what are
Yes.
the consequences?
The consequences of not treating macular degeneration is for your vision just to get slowly worse and worse and worse. Now, even sometimes with treatment, it's going to get worse. It's not a for sure thing that you're going to make it better or reverse it a little bit, but almost always that's what happens. If you do nothing, for sure it'll get worse. It's just a progressive thing. And so I think that that is very, very important for as we age to watch that closely.
Now, is there we had a couple of other notes, a couple of other things to chat about, and we had refractor error as one of our topics.
Yeah, so basically refractive error means, are you nearsighted, farsighted, or astigmatism? And so normally a person can see clear at far with no glasses on. That's the normal situation. If their eyes become too strong, which we kind of think as that happening to me as I was a kid, that I'm getting weaker eyes. Actually, they're too strong. A nearsighted eye is too strong, so you have to have a lens on. Our optical system is a plus optical system. So if you have a +1 lens, it focuses light in 1 meter. Well, our eyes are about 22 millimeters long, so it takes a +60. Our eye has a power of +60. A nearsighted person has eye power of more than that. So we wear glasses that are thinner in the middle, and it brings the light back on our retina. That's called myopia. If a person's eyes are a little bit weak, and as we're youngster, we can focus our eyes stronger, and so we can make up for a lot of that farsightedness just by focusing. So as the focusing gets harder and harder, then you would maybe wear lenses to help with that. And then you get into your 40s and 50s, then it's really hard to focus up close. So those farsighted people have to wear glasses to read up close, where a nearsighted person might take their glasses off to see up close. So it's just the power of the eye. And astigmatism just means that one part of the eye has a different prescription than another part of the same eye. So it's just a distortion in the eye, and you take a lens that's got a distortion in it to match the eye, and everything is fine. And then when they do refractive surgery like LASIK and stuff like that, they can compensate for all these problems quite well.
So now that you brought up the LASIK surgery, so if when we talk about aging adults, so if they get LASIK surgery, before maybe 40 or 50, when their eyes start to change, I mean, would they still end up needing to wear glasses again at some time? Is that possible?
Yes, because let's just say you are a nearsighted person and you wanted to see clear at far and not wear glasses. Well, okay, so if they make it perfect for far, when you get to be 40, 45, you're still not going to be able to focus up close. That's called presbyopia. So then you still wear glasses for reading. So yes, you can still wear glasses. Now, if you had a person that was, say, 40 years old or 45 years old, and they're thinking about having LASIK surgery, we'd say, okay, now you're still not going to get rid of glasses, because as soon as you have your vision fixed far, you're going to wear glasses for up close. It's like people wearing contact lenses. Unless they go to a bifocal contact lens as they get older, they have to wear glasses for reading over their contacts. Some people have one eye for far, one eye for near. That's called monovision. That's, some people like that. I mean, there's a few people doing it. I myself, I couldn't handle it, but some patients can handle it quite well.
Okay. Well, Dr. Foss, this has been I think, very enlightening. I think there's a lot of good information here. Is there anything that you can think of that we didn't talk about, or anything that you would like to share before we wrap up?
Well, I think we should talk a little bit about dry eyes, because this
Okay.
affects every age group. When we blink, there's glands in our lids called meibomium glands, and when we blink, these glands secrete oil. That's where the outer layer of our tears come from. So our tears have kind of several layers in, but there's kind of a mucin layer that makes the tears stick to the eye, then a watery layer that's formed by our lacrimal glands, actually making the tears, and then there's oil glands in our lids called meibomium glands secrete the outer layer, and so they secrete oil that stays on the outer layer. It keeps our tears from evaporating. If we don't blink enough, those glands atrophy. And so the thing that we're seeing now, particularly with people who work on computer, people who play video games a lot, and they get in this staring situation where they're not blinking enough, those glands actually atrophy. And once a gland's ever diminished, it never comes back. You can keep them from getting worse, but you can't make them come back. And so that is very important. So I talk to every patient about blinking. If you're on a computer, I'm telling you, you should take a break every half hour and do like 10 hard 3-second blinks. I've seen some boys that are in their teens that have their meibomium glands 80% gone. And they're the kids that they're doing their schoolwork on computer and they're doing video games. And some of these kids are on computer playing games 10, 12 hours a day, maybe more. And so that is a real big problem. We hardly get a journal now that doesn't have an article in about dry eyes. One of our doctors specializes in dry eyes. She's busy all the time working with dry eye situations. And just in general, if a person does everything right, as time goes by, they've got a better chance of getting dry eyes just with aging. Okay. So if you have all these other things happening, the computer use, the contact lens use, computer games, and not blinking in time, it's going to take its toll. And so I try to talk to everybody about blinking. If you see a child in the office and the patient, what do the parents do to keep them quiet? They give them the phone. So the kids are like this with a phone and watch them. They do not blink. And they're holding it way close. Talk to chiropractors, the posture of people is changing. People are getting more nearsighted because they're looking at close all the time. People's eye posture is turning in. So there's some people, and has to do in therapy to get these kids, their eyes back to, they're aiming back to normal because it's just so much of this near work. And everybody does it. I mean, there's somebody said the other day, I think on news, an average person, adult, puts 4.5 hours on their phone a day.
Wow.
If we were studying 4.5 hours a day, we'd be pretty bright people.
We can change the world. Yes, absolutely.
That's right. Yeah, yeah.
So Dr.
Yeah.
Foss, with the dry eyes and people that work, if their employment requires them, to be in front of a computer, you made some suggestions, as far as, stepping away. Are there glasses or lenses that can help protect your eyes?
Yes. This blue light protection, a lot of people feel is important. We've used a lot of blue light lenses in our office. I typically wear blue light lenses to protect me from blue light, but it does nothing for those glands. Blue light is more kind of protect the retina, try to prevent cataracts, that sort of thing. So the object there is to try to get everybody to be blinking, have moisture. Sometimes we'll tell people that everything I have a problem with, have a little moisturizer right by your a little humidifier right by your workstation. Those things can help, but the most important thing is to try to keep those glands healthy, because you can use eye drops to keep yourself comfortable, but an eye drop does not make those glands get better. It doesn't slow them down. It's a purpose of just blinking to get those glands working again.
Wonderful. That's great information. Can you think of anything else that we need to touch on before we close?
Well, I'm thinking floaters, cataracts, glaucoma.
Yeah.
How diabetes affects the eyes. We did mention that. Dry eyes, macular degeneration. And then I did mention that I think smoking is bad stuff.
Well, the last thing you mentioned supplements briefly. So,
okay.
What might be good supplements, or what do you recommend for eye health?
The supplement we recommend most in our office is one called MacuHealth. It's got mazoxanthine in it, which I think is the only product with mazoxanthine in it. And mazoxanthine is made from lutein in our eyes, And it's the only place you find is right dead center in the macula. So we've had people where we see these macular changes start to happen, and we have them take MacuHealth, it's called, and actually reverses that almost every time. And I've
Wow.
seen some very big breakthroughs in reverse too. Oh, some things that are happening for the future. This instrument we got that measures the retinal health with the EKG. There's a that they have been bought by another company that has a light. It's called photomodulation, which we think can actually reverse dry macular degeneration. So that is something that is available in Europe, South America, but not here yet. So that's something that it should be approved pretty soon here, but it's always slower to get something good in the United States than it is someplace else. It seems to take longer to get things done. And so that's something that I think is going to be really, really nice if it's as good as what it says it is. So that'll be good.
Awesome. Well, Dr. Foss, thank you so much for taking time out of your day to share this amazing amount of information about our eye health. So again, thank you so much. And I
Well,
appreciate
thank you.
your willingness. And so that's going to conclude our video today on eye health. And so we will see you back in the next senior summit video soon. Take care.